So the main telltale sign to know that if you're going into labor is just like if your water breaks. So, but many women, sometimes it's hard to tell because some women sometimes are just urinating, and sometimes they think like, oh no, my water is breaking, because they're expecting this big gush of water, kind of like how we see in the movies when a woman is pregnant and expecting, and there's this huge gush of water everywhere, and it's like this, big thing, and it's like, oh, okay, it's time, right? It's time to go to the hospital. That is not always the case. Some women's waters don't even break, and it doesn't mean and they can still be in labor. So here's some other, and then another thing too is you kind of want to be able to know and identify, which is why it's so great to have a doula or take a childbirth education class, because you'll know kind of more of what to expect and what to happen and what is realistic. So for instance, like you may be in pre-labor, but not necessarily in progressing labor or acting labor to where it's like you need to get to the hospital. It is possible to be experiencing and going through pre-labor days or even like a week really, or two or so before you're going into actual active labor. So closer to your due date, you may be experiencing some cramps in the lower abdominal area, also known as like Braxton Hicks contractions. And these are all good. That means your body is preparing and gearing up for actual labor, but you're not in active labor yet. So this does not cause for going to the hospital, but it can be a little scary and worrisome, especially for first time and new mothers, because you are experiencing all these feelings for the first time. You think that they're contractions, but you're just not sure. So if they're mild and they're very far apart and they don't last long, that's likely pre-labor, but not the type of labor that calls to go to the hospital just yet, or doesn't mean you're going to labor just yet. But those are Braxton Hicks contractions. Another thing that you may experience during labor is, again, some women lose their mucus plug, or also it's also known as the bloody show, is what some people refer to it as. So that's just like a little discharge of like mucus that discharges out. You might find it in your underwear or as you wipe when you're going to the bathroom, and it's just a little bit of bloody discharge. Maybe it might have blood in it, it might not, and just mucusy and a milky, like a white discharge, and it's thick. So if you see that, again, it's nothing to be alarmed about. Some women, you lose their mucus plugs and then still don't go into actual labor for days or maybe even weeks later. And again, it's nothing to be too concerned about. That's just the plug that keeps bacteria from entering into the vaginal area. So if you do lose your mucus plug, I would maybe suggest considering holding off on any intercourse around that time, or inserting anything into the vaginal area, just because now you may be more prone to bacteria entering in there and getting an infection. So I would just steer clear of that area and just rinse with water, mild soap to clean off, but wouldn't use anything too heavily scented around the vaginal area if you do lose your mucus plug. Also, another sign to tell if you're going into labor is if, so now how you know if you're going into active labor is if your contractions start getting really strong, they last for 60 to 90 seconds, and if they're 5 minutes or less apart. Now, this is the time where you are likely in active labor, and now would be a great time to call your doctor, your doula, your midwife, and start making preparations to get ready to go into the hospital or the birthing center, or have your birth team come to your home if you're doing a home birth. So that is the main sign of how you know that you are going into labor. If your membranes do rupture, the breaking of the waters, just take note of the smell of the liquid that comes out, the color of the liquid, how much of the liquid is coming out, and then go ahead and call your birth team and call your doctor and let them know, hey, my water did break, or I believe my water did break, and you know, your nurses will ask all those questions. That way you have that information, you can let them know, and then they'll give you a good indication of like, okay, you know, are you experiencing any contractions? How far apart are they? How long do they last? What's the intensity of the contractions? If it's feeling like you're entering into that active labor stage, then they'll more likely have you come to the hospital, or, you know, whatever the procedure, like however you were planning to give birth. Or if like your contractions are not as close apart, and if you do plan on going to the hospital, but you don't want to be in the hospital that long, then until your contractions start getting closer or if they start intensifying, you may want to stay at home just a little bit longer. That way you can kind of move around freely before actually making your way to the hospital. However, if you live far away from the hospital though, you probably do want to go ahead and start making your way, just for safety reasons, especially for women. If this is your second or third child, your labor may progress much faster than a first-time mother. So those are the reasons and stages of how you'll know that you're going into labor.